This procedure demonstrates the assessment of the nose and sinuses. Cognitive. List the two major signs and symptoms related to nose problems. Chief complaints: sinus pain, nosebleed or epistaxis, frequent cold, altered smell. List the factors to be included in the history of patients suspected to have nose or sinus problem. Allergies, difficulty of breathing through the nose, sinus infections, injuries to nose or face, nosebleeds, any medications taken, any changes in sense of smell. Psychomotor. Pre-procedural steps. Perform hand hygiene. Introduce yourself.
Hello, good morning. My name is Angela and I will be your nurse for today.
Identifies the patient. Ask the patient's name and check the ID band in MRN.
Can you please tell me your full name?
Sara Al-Utaybi.
And can I check your ID band? Okay. Sarah Al-Utaybi, 143-4455. Sarah Al-Utaybi, 143-4455.
Provide for patient's privacy.
I will close the door and curtain.
Explains to the patient what you are going to do, why it is necessary, and how the patient can cooperate.
Miss Sarah, I'm going to assess your nose and sinuses. It is not painful and you will just be placed in a sitting position and I will illuminate your nose and palpate your sinuses. Is that okay?
It's okay. Physical assessment. Assessment of the nose. Inspection and palpation. Inspect the external nose for any deviation in shape, size, color, and flaring of or discharges from the nares.
Okay, Miss Sarah, I'm just going to inspect your nose. Okay, what we have here, the nose is symmetric and in the midline in proportion to facial features. There is no nasal flaring or discharges noted.
Lightly palpates the external nose to determine any areas of tenderness, masses, or displacement of bone in cartilage.
Miss Sarah, I'm going to lightly palpate your nose, so kindly tell me if you feel any pain or discomfort, okay?
Okay.
Okay, in this case, no tenderness, no masses, or any displacement of bone and cartilage.
Determines patency of both nasal cavities. Test the patency of the nostrils by pushing each nasal wing shut with your finger while asking the person to sniff inward through the other nares. This reveals any obstruction. Repeat the procedure to assess patency of the opposite nares.
Miss Sarah, with your index finger, can you please push your nostril and sniff like this? And do it also on the other side. The other side. Okay, good.
Inspect the nasal cavities using a flashlight or a nasal speculum. Holds the speculum in the right hand and inspect the patient's left nostril, and in the left to inspect the patient's right nostril. Tips the patient's head back. Facing the patient, insert the tip of the closed speculum about 1 centimeter or up to the point at which the tables widens. Care must be taken to avoid pressure on the sensitive nasal septum. Stabilizes the speculum with the index finger against the side of the nose. Use the other hand to position the head and then to hold the light. Opens the speculum as much as possible and inspect the floor of the nose, the anterior portion of the septum, the middle meatus, in the middle turbinate rarely is visualized because of its position. Inspect lining of the nares and the integrity and the position of the nasal septum.
Okay, Miss Sarah, as I can see here, the nasal mucosa is light red in color. It is smooth and moist. No perforation or bleeding noted. No deviation of the septum.
Observes for the presence of redness, swelling, growth, and discharge.
There is no swelling, no polyps, or any abnormal growth.
Inspect the nasal septum between the nasal chamber.
Nasal septum is normal and no deviation.
Facial sinuses. Palpation. Palpate the maxillary and frontal sinuses for tenderness. Use your thumbs. Presses the frontal by pressing up and under the eyebrows, maxillary sinuses, and below the cheekbones.
Miss Sarah, I'm going to palpate your sinuses and please tell me if you feel any pain or discomfort. Do you feel any pain, Miss Sarah?
No.
Okay, there is no pain or tenderness noted.
Post-assessment care ensures the safety and comfort of the patient. Ensures that the patient is covered and is in a comfortable position.
Miss Sarah, are you comfortable in this position?
Keeps the side rails up. Keeps the bed in the lowest position. Bed breaks on. Call bell within the reach of the patient.
Miss Sarah, the call bell is beside you. If you need anything, just press it.
Perform hand hygiene. Document all important findings. Students should verbalize their specific findings or write in the documentation paper.